What if I told you that the position you sleep in every single night is silently destroying your testosterone production, crushing your testicles, restricting pelvic blood flow, and causing the erectile dysfunction you've been blaming on age? And what if I told you that one simple change to your sleep position tonight could increase testosterone by up to 40%, restore morning erections, and dramatically improve your sexual function within 2 weeks? I'm Dr. Sophie Morgan, board certified urologist with over 15 years specializing in men's sexual health and hormonal optimization. I've treated over 4,500 men dealing with low testosterone and erectile dysfunction. And I can tell you this: the vast majority have no idea that their sleep position is sabotaging their hormones and function every single night for 8 hours straight. In the next 15 minutes, I'm going to reveal exactly which sleep positions are destroying your testosterone, explain the precise mechanism of how sleep position affects testicular function and hormone production, show you the optimal sleep position that maximizes testosterone and erectile health, and give you the complete nighttime protocol that ensures maximum hormonal recovery. I'll share patient stories of men who changed nothing but their sleep position and saw testosterone levels rise by hundreds of points and the week-by-week timeline of what to expect. But here's the thing: most men have slept the same way for decades, without realizing they're causing chronic testicular compression, overheating, and restricted blood flow that devastates testosterone production and erectile function. So if you stay until the end, I'll give you the exact pillow positioning and body alignment strategy that ensures optimal hormonal health every night. Let me be brutally honest with you. The reason your testosterone has been declining isn't just age. It's not just stress or diet. For many men, it's 8 hours of nightly damage that nobody's warned them about. Here's what's really happening. Your testicles are external organs for one critical reason: temperature regulation. Sperm production and optimal testosterone synthesis require a temperature approximately 2 to 3 degrees Celsius lower than core body temperature. That's why your testicles hang in the scrotum, away from your body. When testicular temperature rises even slightly, testosterone production plummets and testicular function suffers. But here's the problem: certain sleep positions create chronic overheating, compression, and restricted blood flow to your testicles. When you sleep on your stomach, you're crushing your testicles between your body weight and the mattress for 8 hours. When you sleep in tight positions with your legs together, you're trapping heat and preventing natural thermoregulation. When you sleep in certain side positions without proper support, you're creating testicular torsion risk and restricted blood flow. The result, after decades of this nightly damage: testosterone production that's 40 to 60% lower than it should be, testicular atrophy, actual shrinkage of the testicles, reduced sperm quality, erectile dysfunction from both hormonal insufficiency and chronic pelvic restriction. And you wake up every morning with no morning erection because your body spent the entire night in a position that suppressed testosterone and restricted blood flow. A 2014 study published in the journal Human Reproduction found that men who sleep in positions that increase scrotal temperature have measurably lower testosterone levels and reduced sperm quality compared to men who sleep in positions that allow optimal temperature regulation. Another study from 2017 showed that even a 1-degree increase in testicular temperature sustained over several hours significantly reduces testosterone synthesis. Now here's what makes this worse. Most men have no idea this is happening. You go to your doctor complaining about low energy, reduced libido, erectile dysfunction. They test your testosterone, find it's low, and immediately want to put you on replacement therapy. But nobody asks, how do you sleep? Are you compressing your testicles every night? Are you overheating them? What if, instead of injecting synthetic testosterone, you simply stopped sabotaging your body's natural production? What if you gave your testicles the optimal environment to function the way they're designed to? That's exactly what changing your sleep position does, and the results can be dramatic within days to weeks. For those new here, I'm Dr. Sophie Morgan. I'm a board-certified urologist, and I've spent over 15 years specializing exclusively in men's sexual health, testosterone optimization, and reproductive medicine. I've treated over 4,500 men from their 30s to their 80s dealing with hormonal decline and sexual dysfunction. My mission is simple. I'm tired of seeing men put on testosterone replacement therapy when simple lifestyle modifications could restore natural production. I'm tired of watching men suffer erectile dysfunction and low libido without anyone addressing the mechanical factors destroying their hormonal health. I've had patients increase their testosterone by 200, 300, even 400 points just by changing their sleep position and nighttime protocol. I've seen men in their 60s restore morning erections within 2 weeks of sleep position correction. I've watched energy return, libido skyrocket, and erectile function improve dramatically, all from optimizing the 8 hours they spend unconscious. What makes this video different is this. Most doctors never ask about sleep position. It's not part of standard evaluation. But the research is clear. Sleep position directly affects testicular temperature, hormone production, and vascular health. Now, if natural testosterone optimization and restored function matter to you, hit that like button right now. Drop a comment telling me how you currently sleep, and subscribe so you never miss these videos on men's hormonal health. Let me reveal the sleep positions that are destroying your testosterone and erectile function right now. The worst position? Sleeping on your stomach. This is catastrophic for testosterone production. When you sleep face down, your entire body weight compresses your testicles against the mattress for 8 hours. This creates sustained pressure that restricts blood flow to the testicles, increases local temperature from trapped heat, and can even cause microtrauma to testicular tissue. Studies show that stomach sleeping increases scrotal temperature by 1.5 to 2 degrees Celsius compared to optimal positions. That temperature increase alone can reduce testosterone production by 30 to 40%. The compression also restricts arterial blood flow, meaning your testicles aren't getting adequate oxygen and nutrients needed for hormone synthesis. I've seen men with testosterone levels in the low 300s who were stomach sleepers. When they switched positions, their levels rose to 500, 600, even 700 within 8 to 12 weeks with no other changes. The second worst position, side, sleeping with legs together and no support. When you sleep on your side with your thighs pressed together, you're creating a heat trap. Your testicles are compressed between your legs, temperature rises, and you're preventing the natural convective cooling that should occur during sleep. Additionally, certain side positions without proper pillow support can create twisting or tension on the spermatic cord, the structure that supplies blood to your testicles. This can restrict blood flow and, over time, contribute to reduced testicular function. The third problematic position, sleeping on your back with legs flat and together. This is better than stomach or compressed side sleeping, but it's still not optimal. When your legs are together, you're still creating some heat trapping and not allowing maximum airflow for temperature regulation. Now let me reveal the optimal sleep position for maximum testosterone production and erectile health. The optimal position is sleeping on your back with your legs slightly apart and elevated support under your knees. Here's exactly why this works and how to set it up. Position. Lie on your back. Place a pillow under your knees so your knees are bent approximately 15 to 20 degrees. This creates slight hip flexion, which takes pressure off your lower back and naturally allows your legs to fall slightly apart. Approximately 6 to 8 inches between your knees. Why this works? First, your testicles hang freely with no compression whatsoever. Second, the slight separation of your legs allows maximum airflow and convective cooling around your scrotum. Third, the neutral spinal alignment improves overall circulation, including pelvic blood flow. Fourth, this position prevents any twisting or tension on the spermatic cord. A 2016 study found that men who sleep on their backs with proper support and leg positioning have scrotal temperatures that are 1.5 to 2 degrees lower than stomach or compressed side sleepers. That temperature optimization translates directly to increased testosterone production. Additional optimization. Use breathable, loose-fitting underwear or sleep without underwear entirely. Tight boxer briefs or compression underwear trap heat even in optimal sleep positions. Cotton boxers or nothing at all allows maximum temperature regulation. Use breathable, natural fiber sheets. Synthetic materials trap heat. Cotton or linen sheets allow better airflow and temperature management. Keep your bedroom temperature between 65 and 68 degrees Fahrenheit. Cooler room temperature supports optimal testicular cooling. Studies show that men sleeping in rooms above 70 degrees have measurably higher scrotal temperatures and reduced testosterone production. Use a fan for additional airflow. Even gentle air circulation across your body enhances convective cooling and supports temperature regulation. Now, let me give you the complete nighttime protocol that maximizes testosterone production and erectile health. Evening preparation starting 2 hours before bed. Avoid alcohol. Alcohol suppresses REM sleep, where testosterone production peaks and it increases core body temperature. Avoid heavy meals within 3 hours of sleep. Digestion raises core temperature. Do light stretching or gentle yoga. This reduces muscle tension and improves circulation. 1 hour before bed, take a cool shower. Not ice cold, but comfortably cool. This lowers your core body temperature and primes your body for optimal testicular cooling during sleep. The cool shower also signals your circadian rhythm that it's time for rest. Bedroom setup. Temperature set to 65 to 68 degrees. Fan positioned for gentle airflow. Natural fiber sheets, blackout curtains, or eye mask for complete darkness. Darkness is essential for melatonin production, which supports testosterone synthesis. Sleep position setup. Lie on your back. Place a firm pillow under your knees. Not too high, just enough to create 15 to 20 degrees of knee bend. Allow your legs to naturally fall 6 to 8 inches apart. Place your arms at your sides or on your chest, not above your head, which can restrict circulation. Wear loose cotton boxers or sleep nude from the waist down. Your testicles should have zero restriction and maximum airflow. During the night, if you wake up and find yourself on your side or stomach, immediately return to the back position. It takes 2 to 4 weeks to retrain your sleeping habits, but it's essential. Some men use a tennis ball sewn into the front of their sleep shirt for the first 2 weeks. If they roll onto their stomach, the discomfort wakes them and they readjust. Once the habit is formed, you'll naturally maintain the position. Morning assessment. When you wake, take note. Do you have morning erection or firmness? This is your daily feedback that hormonal production and vascular function are optimizing. Most men see return of morning erections within 1 to 3 weeks of sleep position correction. Let me tell you about David, 64 years old, who came to me with testosterone levels of 320 and complete absence of morning erections. He'd been a stomach sleeper his entire adult life, over 40 years of nightly testicular compression. I explained the mechanism and put him on the optimal sleep position protocol. He was skeptical, but willing to try anything before starting testosterone replacement. Week 1. He struggled to maintain the back position and kept waking up on his stomach, but by day 5, he started waking with slight morning firmness, maybe 20%. First time in over 2 years. Week 2. He was maintaining the back position most of the night. Morning erections were now 50% and occurring 4 to 5 times per week. Week 4. We retested his testosterone. It had risen from 320 to 485. David was shocked. I told him this was normal. He'd stopped suppressing his natural production. Week 8. Testosterone tested at 580. Morning erections were consistent, strong, and lasting 5 to 10 minutes. His energy had returned, his libido was back, and his erectile function during intimacy had improved dramatically. Week 12. Final test showed testosterone at 627. David said, "I feel like I'm 50 again, all from changing how I sleep. I can't believe something so simple had such massive impact." David's wife confirmed that their intimate life had completely transformed. His confidence, energy, and function were better than they'd been in over a decade. Then there's Robert, 71 years old, who'd been on testosterone replacement therapy for 3 years but still felt suboptimal. His doctor had him at 150 milligrams per week of injected testosterone. but his levels were barely reaching 450, and he had no morning erections. I asked about his sleep habits. He was a side sleeper with legs clamped together and wore tight compression boxer briefs to bed. I explained he was fighting his own treatment. The replacement therapy was trying to raise testosterone, but his sleep position was destroying testicular function and restricting blood flow. He switched to the optimal back position, loose boxers, cool bedroom, fan for airflow. Within 3 weeks, his morning erections returned. His doctor was able to reduce his testosterone dose to 100 milligrams per week, and his levels actually improved to 520 because his testicles were now contributing natural production instead of being completely shut down. By week 12, Robert's doctor reduced him to just 75 milligrams per week, half his original dose, and his testosterone was stable at 540 with strong morning erections and excellent erectile function. The sleep position optimization had restored enough natural production that he needed far less external testosterone. Another patient, 59-year-old James, changed only his sleep position and bedroom temperature. No supplements, no medications, no other interventions. His testosterone went from 380 to 590 in 10 weeks. He told me, "I have more energy at 59 than I had at 55. My wife says I'm like a different person." Let me give you the realistic week-by-week timeline. Week 1, you're retraining your sleep position. You'll likely wake up multiple times having rolled to your old position. Immediately correct back to the optimal position. Some men see slight morning firmness by day 4 or 5, but most notice nothing yet. Your body is beginning to adapt. Week 2, sleep position is becoming more natural. You're staying on your back for longer periods. Morning erections may begin returning, typically 20 to 50% firmness, occurring 2 to 4 times this week. You may notice slightly better energy during the day. Weeks 3 to 4. This is when most men see clear improvements. Morning erections become more consistent, 50 to 70% firmness, 4 to 6 times per week. If you test testosterone, you'll likely see a 50 to 100 point increase from baseline. Libido often increases noticeably during this window. Weeks 5 to 8. The transformation zone. Morning erections are strong and consistent, 70 to 80% firmness occurring most mornings. Energy, motivation, and mental clarity improve significantly. Erectile function during intimacy becomes more reliable. Testosterone tested during this period typically shows increases of 150 to 300 points from baseline. Weeks 9 to 12. Stabilization phase. Your new sleep position is now habitual. You naturally maintain it through the night. Testosterone production has optimized at your new set point. Morning erections are robust and sustained. Overall, sexual health, energy, and vitality reflect the hormonal optimization. Beyond 12 weeks. With continued optimal sleep position, benefits are sustained long-term. Your body maintains higher natural testosterone production as long as you maintain the position. If you return to stomach or compressed sleeping, testosterone will decline again within 2 to 4 weeks. The key insight: sleep position affects 8 hours of every 24-hour day. That's 1/3 of your life. Optimizing those 8 hours has massive cumulative impact on hormonal health. Now, I need to be completely clear about safety and important considerations. If you have sleep apnea, back sleeping may worsen symptoms. Consult your sleep specialist about using a CPAP device or other interventions that allow back sleeping without apnea episodes. Untreated sleep apnea destroys testosterone even more than poor sleep position, so this must be addressed. If you have severe lower back pain, the pillow under your knees should help. But if back sleeping is genuinely painful, you may need physical therapy or medical evaluation before optimizing sleep position for hormonal health. If you're on testosterone replacement therapy, do not stop your treatment without physician supervision. However, optimizing your sleep position may allow your doctor to reduce your dose while maintaining or improving your levels. This should be done gradually under medical monitoring. If you have testicular pain, swelling, or any acute symptoms, see a urologist immediately. Sleep position optimization is for functional improvement, not for treating acute medical conditions. Expected improvements. Most men see 50 to 150 point testosterone increases within 8 weeks. Some men, especially those who were severe stomach sleepers with significant suppression, see increases of 200 to 400 points. A small percentage of men are non-responders, typically those with primary testicular failure where the testicles themselves are damaged and cannot increase production regardless of optimization. Morning erections return for about 70% of men within 2 to 4 weeks. The remaining 30% typically see improvement but not complete restoration, indicating other factors are involved that need to be addressed. Let's bring this all together, gentlemen. One change: your sleep position. Tonight, stop sleeping on your stomach. Stop sleeping with compressed legs. Stop wearing tight underwear to bed. Stop overheating your testicles for 8 hours every night. Start sleeping on your back with knees supported and legs slightly apart. Start using breathable materials. Start keeping your bedroom cool. Start giving your testicles the optimal environment to produce testosterone the way they're designed to. Most men see morning erections return within 2 to 4 weeks. Most men see testosterone increases of 100 to 300 points within 8 to 12 weeks. Zero cost, zero medication. Just respecting your body's biology. Erase the belief that testosterone decline is inevitable. Remove the assumption that you need injections or medications. This is your body. This is your hormonal system. Give it the right conditions and it will function. If this information opened your eyes, smash that like button right now so more men can discover this. Subscribe if you're serious about natural testosterone optimization. We're building a community of men who refuse to accept hormonal decline as normal aging. Drop a comment right now telling me, how do you currently sleep? Have you lost your morning erections? Will you try this tonight? I read every comment. Share this with one friend who's struggling with low testosterone or erectile dysfunction. You could change his life with one simple sleep position correction.